In the name of all our team, thank you for the opportunity to present our work today. I have nothing to disclose. Laparoscopic Roux-En-Y gastric bypass is one of the most commonly performed surgical procedures of this era. However, as the procedure has become more popular, heterogeneity on certain steps of the operative technique have arose and become controversial, leading to difficulties in standardizations and reproducibility of outcomes. One of such has certainly been the technique for construction of the gastrojejunostomy. In general, the GJ can be performed either with a hand-sewn technique using laparoscopic intracorporeal sutures, with a mechanical technique performed with a linear stapler, or using a circular staple with a detachable anvil. Even though it is currently accepted that both mechanical and hand-sewn techniques are feasible and mostly depend on surgeon preference, there has been persistent debate in the topic as data from trials have been conflicting and there is no consensus to which of these GJ anastomosis is superior for weight loss. In our study, we performed a retrospective analysis and compared the outcomes of patients subjected to laparoscopic Roux-En-Y gastric bypass in a high-volume center where the three different GJ techniques are performed with equal frequency and proficiency. The aim of this study is to assess a 1-year weight loss after laparoscopic Roux-En-Y gastric bypass, comparing the three different techniques at our center. This is a retrospective review of electronic medical records of obese patients who underwent laparoscopic Roux-En-Y gastric bypass in our center. Data from MBSA's WIP database of our medical center from 2014 to 2017 was collected. Patients were designated to three different groups depending on the type of gastrojejunal anastomosis performed: hand-sewn, circular staple, and linear staple. We review medical charts for the preoperative assessment and the 30 days and 12 months follow-up. The collected data were demographics, weight, BMI, comorbidities, and the type of anastomosis performed in the surgical procedures. We also evaluated weight, BMI, and percentage of excess weight loss at 12 months of follow-up. The study was approved by the Institutional Review Board. The primary endpoint of this study was the weight loss 1 year after the procedure, depending on the type of anastomosis performed. A total of 1,011 patients were submitted in our center to a non-revisional laparoscopic Roux-En-Y gastric bypass from 2014 to 2017. 429 patients had a circular staple anastomosis, 433 patients had a hand-sewn GJ anastomosis, and 149 had a linear staples GJ anastomosis. There was a significant statistical difference in age between the three different groups, being the linear staple groups, the one who has the older patients, but with a small difference when compared with the overall mean. There were no difference in BMI and ASA classification amongst the three groups. There were no difference in gender between the three groups, with a higher prevalence of females in all of them. There were no difference of patients' comorbidities between the three groups, as is shown in these two tables. (44% of circular staple patients developed a postoperatory surgical site infection, and there were no cases in the other groups. This is likely due to the contamination of the abdominal wall when the staple is being retracted. The need of transfusion was increased in both the staple groups, linear and circular, when compared with the Hansen group, and this was statistically significant. Regarding the major complications rate, there is no difference between the three groups. The shorter mean operated time was found in the circular staple group. The longer mean operated time was found in the linear stapler technique, where there is a critical step in which the pouch has to be long enough to allow to create the anastomosis. There was a statistically significant difference in the length of stay between the three different groups. There were no difference in the BMI between groups at the 1 year follow-up. Also, there is no difference in the percentage of excess weight loss at 1 year follow-up. This demonstrates that weight loss is not related to the GJ technique chosen by the surgeon. As a conclusion, there was no difference in weight loss 1 year after the laparoscopic Roux-En-Y gastric bypass, despite how the GJ anastomosis was performed. The use of staplers, linear or circular, increased the need of transfusion for patients. Only patients who had their GJ anastomosis performed by the circular stapler had surgical site infections. Randomized controlled trials are needed to better understand the difference in these different types of anastomosis. Thank you.